Today, I am Dr. Surendra Nehru, MD physician. This is a first time in the world I could create an app wherein you can add lifestyle modification, nutrition, exercise along with the pharmacy, medicine. Only with you give the drugs, the survival success rate is only 0.25%. This has come in a major study wherein people where we are giving only medicines and sending off the patient, giving them a printed diet sheet, the success rate is very low. That is why I tried to add lifestyle modification into this. And here, as you can see in the screen, I have created a remission of obesity, coronary artery disease, diabetes, hypertension, which are the major disorders. This is the screen where you land up once you click on my link. You can go to www.homahealthcarecenter.in, or if you see my videos in the YouTube also, you'll have my link. And or you can WhatsApp to me 0996 3721 999. First time in India we are seeing poverty with obesity. Very rare, peculiar. On one side, people are unable to afford minimum basic needs, and on the other side, they are becoming obese. Very peculiar, this is the problem. There are 100 crore people who earn less than $10 per day, or I don't know, around 600 to 800 rupees per day. Less than that they are earning. And peculiarly, they are becoming obese. And in obesity, in India, we have peculiarly at the central obesity. With 1 inch tape, we can make out with 1 rupee. If the waist circumference is more than 85 centimeter, you are at a metabolic dysfunction. So here I created a remission for 90 days. And for key parameter indicators should be there. Where you are going, that is where the compass is more important. Just like Google Map, I am giving you a guidance. The problem with India is they have something in their heart. They listen something with their brain and execute something from their hallucination. There is a multi-pronged delusion, illusion, hallucination, and finally ending up in Siberia. Every Indian out of the 150 crores, they all end up in Siberia. They just can't guide themselves. India, China, these are all old countries where everybody has their own opinion about everything. The key parameters which I have added are HOMA-IR, which is nothing but fasting insulin to fasting blood sugar divided by 405. Insulin is a lipogenic hormone, that is, it increases the fat cells around the abdomen. This can increase in the heart and you can develop coronary artery disease. Out of 100, only 11 will develop diabetes, another 14 will develop pre-diabetes. So endocrinologists, diabetologists, they are not interested in obesity because only 26% can develop diabetes out of 100, and pure diabetes can happen only 11 to 12%. Rest of the people, they can end up either only in hypertension or coronary artery disease, but 60 to 80% they have dyslipidemia. Another lipid problem which nobody bothers is their increase in triglycerides. So second marker that I have kept is, one is HOMA-IR, fasting insulin to fasting blood sugar divided by 405. If it is more than 2, that shows already your metabolism is gone. You have started your journey from Hyderabad or Delhi or Bangalore to Tajikistan. You are nearing Siberia. Still you are not bothered. Your waist circumference is more than 85 centimeters, 33 inches. And if you do a fasting insulin, it will be very high. Unfortunately, if I tell the doctors to get fasting insulin, nobody is getting it done. And if at all 1 or 2 they do fasting insulin, it will be between 2 to 23, very wide range, and it is normal, they think. But if you multiply fasting insulin to fasting blood sugar, peculiarly sugar will be normal, insulin will be in the normal range. But if you multiply and divide by 405, it will be always more than 2.3, which indicates insulin resistance. These people, till the 80-95% of the beta cells are destroyed, HbA1c will be normal. So in India, HbA1c is important, so I kept that marker. Next, another key parameter indicator is triglyceride to glucose index. Everybody can go to Google, click free online glucose index calculator. You can log in fasting triglyceride, fasting blood sugar, and give the value more than 4.5. It shows what all the carbohydrates, rice, wheat, your besan, all the products that you are eating, your proteins, your lipids are getting converted into triglycerides. First time in the world we added our carbohydrate and a lipid and used a profile and ratio. Even now, if we see all the lab tests of all the major hospitals, major diagnostic center, they give only lipid to lipid ratio. This is the first time in the world we are using a carbohydrate to lipid ratio. I have been presenting with in PubMed, NMC, guided, agreed, printed and online papers I have presented on this topic. Next is central obesity, which is a marker, and coronary artery disease. In India, LDL is very important, and lipoproteinemia we are not doing, apoprotein we are not doing. Next is hypertension. I have added the systolic and diastolic blood pressure and diabetes, fasting blood sugar. These are the key parameters you can know where you are going. Without these parameters, whenever I go ask somebody to reduce weight, they are going for high protein, high fat, low carbohydrate diet and reducing their weight and thinking they are healthy. Why to pay for the doctor? Except health, we have money for everything. So Indians and Chinese, we can't argue. We have to leave it to them. Since 30 years, I have been practicing. Some lakhs of patients I have seen. Nobody listens to anything. It is up to them. But now what I want to tell you, the technology is available. Somebody wants to know where they are. If they don't want to go to Siberia and stay and get a good health, there are parameters. This is the website. And 90-day journey I have given from day 1, day 3, day 7, day 90. You will have you can see how you are working, where you are going, everything I have chronicled, everything I am using evidence based. So no chance of going into Siberia when you are with me. You can know where you are going, and these are the packages that are available. Just you have to go for a create account, add your name, your email address, phone number, keep a simple password, confirm password and create an account. From then you can come to my website and you can come to my and see what all that are there. This is the first time in the world I created not only medicines but diet with exercise with sleep. These are the parameters which I will be adding, and you can check for yourself how much is your nutrition, how much workload you are doing. Till we do that like that strictly, this is the 90-day program, you will not get success. So many people have been able to use it successfully. They could come out of their health problems. They could in the beginning, if anybody is there, obesity with diabetes, definitely whenever the waist circumference has come down, the HbA1c is coming down, the fasting blood sugar is coming down. This is all insulin resistance. Not only insulin deficit, everybody is focused on insulin deficit, that is beta cell failure, and immediately add one drug which pumps more insulin into the body, and we are adding 3 drugs, 4 drug regimen, afraid of hyperglycemia, and they're genuine. I don't criticize them. But at the same time, in India, I have to think that we are having high carbohydrate and peculiar diets we have, 3 lakh diets we have. So I created a NutriBot wherein you can know 3 lakh diets of Indians and 1 lakh diet from outside I have added. You can enroll all this and you can check for yourself and be online and come to your center without going into the Siberia. That is the only difference between me and others is I will be guiding you if you follow me, and within 30 days to 90 days I can train you, understand your body, create awareness of your brain, how your brain is working, mainly the mental problem, diabetes, obesity, heart attacks and all are nothing but some kind of mental agony will trigger all these things. So where you are going, mental health, how it is there, I can guide you. My name is Dr. M. Surendra Nehru, MD Physician, Professor of Medicine. My number is 0996 3721 999. For somebody who wants to try also, I am given 100 tokens free. You can use your tokens, use the NutriBot app, In that app you can use the how exactly you are going and all. You can have a lot of information of proteins, carbohydrates and all. Each food from rice, like biryani rice and all, where around each state is having a separate rice model. So for every state of India I have written, and including all the 7 continents, taking from the websites of the major countries like Chinese, Indian, ICMR, American, European. I have created a nutrition app. In that you can take what exactly you are eating, you can make out. You can join me if you like me, criticize me, comment on my video, join Quit India Obesity and Diabetes program.